There is a coded universal language in our healthcare system used to describe medical procedures performed by healthcare providers at an institution or a hospital. But how does this system work to meet the needs of providers to document services provided? And how does it stay up to date with constant changes? Let's get into it. CPT, or current procedural terminology codes, are a numerical 5-digit code used to describe the tests, surgeries, evaluations, and any other medical procedure performed by healthcare providers at an institution or hospital. They are divided into 3 categories, each with its own purpose and type of service. Category 1 codes are the most commonly used. They represent procedures that are consistent with contemporary medical practice and are widely performed, such as the 99214 code, which describes a 30 to 39 minute follow-up office visit. These codes are 5 digits long and do not end in F, T, or U. Category 2 codes are optional performance measurement tracking codes that provide extra information about the quality of care, such as the 3008F code for documentation of BMI. These codes end in the letter F. Finally, Category 3 codes are temporary codes for emerging and experimental services, technologies, and procedures, such as the 0515T code for insertion of experimental pacemaker. These codes end in the letter T. Understanding these categories and using the correct CPT codes is crucial for accurate billing and tracking of medical services. But how do CPT codes stay up to date with the ever-changing landscape of healthcare procedures and technology? Well, the American Medical Association, who standardizes and publishes these codes, makes regular updates to the list every year. This strict standardization enables seamless processes and advanced analytics in medical services. As a healthcare system evolves, new codes can be developed for new services, current codes can be revised, and old, unnecessary codes can be discarded. The CPT coding system is incredibly important for healthcare providers to make sure they are correctly logging and billing the correct procedures for the correct patient. Without a code set to match services to, hospitals would have no way of tracking this data. This would create massive revenue integrity issues that can affect the entire revenue cycle of a hospital system. To ensure healthy revenue integrity, hospitals must adhere to and audit their coding processes so that way when errors occur, they can quickly be resolved. Like this video? Be sure to give us a like and subscribe to our channel for more great revenue cycle content.